Hi, it's Kitty Call again. I did promise that I would do a vlog on sex and severe mental illness, sex and schizophrenia and schizoaffective disorder. So I've really been looking on Google for a lot of for information to see, what there is out there. And to be honest, there are so many different issues regarding this topic that it's difficult to pin it down to just a few things. And to be honest, this might be the first part of another of 2 vlogs or of even 3 vlogs. This first one that I've kind of planned is quite dry, and I know that's probably quite boring for you to watch because I'm not good at making videos and I'm a bit clueless. I'm nearly 40, for God's sake, so I don't know about these things. And I found a couple of good psychological research reports on this, and I wanted to take you through them today. So today might be a bit boring for you. I've chosen to do it up in my bedroom. I say chose, but basically my living room was a big mess because I've had some deliveries and things recently. I've got boxes and things downstairs and I need to clean the house, especially as I've promised that I'll, take you through my house on my phone and show you what my house looks like. Maybe you might need to tidy it up first. So anyway, it's appropriate. We're talking about sex. We're in a bedroom, but this won't be very sexy. This is quite serious stuff. So I shall get on with it as much as I can. I've printed out some things from Google. There was a book I really wanted to buy. It's on Amazon about sex and severe mental illness, and done by some serious psychologists, but I just couldn't afford it. It was like £25–30. It was too much for me. So this is the first report I'm going to refer to is Sexuality and Schizophrenia, a review by Deanna L. Kelly and Robert R. Conley. And as I said, there's so many different aspects to this. One of the major aspects is that people who have schizophrenia can tend to be more abused and taken advantage of than the general population because we're vulnerable. People with severe mental health problems are vulnerable. We are more likely to be attacked and to be victims of violence, especially women, concerning sexual violence, than anyone else. But this is not going to be part of this for today. I think that's a serious issue and it deserves its own time because there's going to be so much to say about that. So what they've basically discovered, if I read a little bit of this out to you, is they've said that sexual functioning has received little attention as an important aspect of patient care for those suffering from severe mental disorders such as schizophrenia. Yet it has been implicated as one of the major factors contributing to non-compliance with antipsychotic medications and is documented by people with schizophrenia to be one of the areas of treatment with the most unmet needs. A stronger focus on sexuality and preventing sexual dysfunction in schizophrenia would likely be a major benefit for improving treatment. And they repeat this theme all the way through the report. You can find this on Google, that people with schizophrenia actually do want to talk about sexual dysfunction and sexual problems, because my general overview of this, some people think, mental health people, we're all so crazy, we're having a great time. Maybe some people with bipolar are, and then they really regret it, or borderline personality disorder are, and then really regret it. But I can pretty much generalise and say that if you have a severe mental health issue, especially schizophrenia or schizoaffective disorder, it's unlikely that you're getting much, okay? So not so sexy, and that there are a whole load of problems and you're actually probably feeling incredibly lonely. And even sometimes those of you who are in partnerships, those rare people of you who can hold together a long-term relationship. So what this then goes on to say, roughly, before I read any more out, is this article focuses mainly on the effects of medication and the physical effects of schizophrenia. One of the things it says is that people who are first becoming psychotic they've already noticed in some studies that there are some hormonal imbalances, and the hormonal imbalances might make the illness worse. In a sense, it's not necessarily just to do with the medication, but then also that the medication has huge effects on sex drive. I spoke to a woman when she was talking about the effects of medication on me, and she was really doing a serious she was a psychology student, and she was doing a serious study into the effects of medication, the side effects of antipsychotics. And I mentioned to her about sexual dysfunction, and she said, well, you know, most of the work's been done on men, she said, because that's easier to measure. You know, you can, it's physical then, isn't it? If a man can't get an erection, if he's ejaculating before he's ready, really, if he's not getting much pleasure and all the rest of it, you know, that's quite easy to measure. Whereas with women, we tend to be more passive and can go along and have sex even if we're not really into it, which is very unhealthy for us, and it's not what our male partners want from us anyway, the normal ones anyway. The other ones need to be locked up in forensics. So, you know, that's the thing. Very little studies have been done, nothing really particularly on women and sexual dysfunction, and that's quite disturbing really, because if you think about it, you know, relationships and love and falling in love and being a sexual being, all these things are so important to happiness in the general population, and even more so with us. And it's been shown time and time again that schizophrenics and severe bipolars, when they get involved in a steady relationship or marriage, a proper committed relationship, they improve vastly and they get better, and that their partner, although it might be difficult for the partner to cope with, but it's a huge source of support for the person who's ill. So this is mainly focusing, this article, on how psychiatrists see it. Then I found the Holy Grail afterwards, and I'm going to really spend some time with that, which it's a study that's done from the perspective of the ill patient, of the person. So they're saying sexuality is a natural component of human behaviour, and the nature of sexual behaviour in the normal population has been well addressed. For those suffering from severe mental disorders such as schizophrenia, however, sexual functioning has received little attention or recognition as an important aspect of their care. Until recently, discussing sexual issues with schizophrenia patients was considered inappropriate because it was believed that they should not engage in sexual activity. And this is to do with prejudice and stigma, you know. In fact, in the early 1900s, some researchers believed that sexual excesses could actually cause insanity, that old, you know, Victorian thing. As recently as the 1970s, psychiatrists believed that sexual activity could contribute to the development of schizophrenia in most patients with this illness. Well, we're not really getting much, so I doubt that. Although this belief is no longer held, little has been done to effectively address this important life issue in people with schizophrenia, and too little is known about the natural history of sexual functioning in people with schizophrenia. And then they've brought up again, I mean, you know, whenever myself I've tried to bring up even in counselling with a really great psychologist or whoever I'm talking to, you try and mention sex and romance with them, they completely freak out, you know, they don't want to talk about it, and you can see they're really trying to be calm and professional, and you know, if those are your concerns, you know, and they're not prepared to talk about it, and that's perfectly understandable. My personal point of view is that somebody within the resource centres, for instance, I go to resource centres in Croydon where my psychiatrist is based and my care coordinator is based, I think they should have a specific person, a specific psychologist who works on sexual dysfunction and romantic relationships and social relationships. Someone that you can go and talk to about anything, and they're going to be informed, because it's not always appropriate to talk about it with your psychiatrist. My psychiatrist is a male, he's really lovely, but he's a man, I don't feel comfortable. And other professionals might not feel informed enough to be relaxed and comfortable and open about this with you. And it says this here, it says, it says that it says people in schizophrenia engage less overall in sexual activity. But it says the reports are confounded by several issues. First, psychiatric staff members are reluctant to discuss sexual concerns with patients. Oh, yes. This discomfort is compounded by the fear that people with schizophrenia cannot manage their sexuality, and that discussing these issues might trigger inappropriate behaviour. I think mainly for men, and maybe women getting obsessed, or I don't know. Psychiatrists have reported that discussing sexual issues may slow recovery. No, maybe it's the lack of hope that you're going to one day be married and be happy that might slow your recovery. If you really look at it, the thought of, oh God, I might as well give up. It's never going to happen for me. Reading all these things, this is why I'm sharing it with you, has really comforted me, because I thought I'm not alone in what I've been through and the different stages of the illness and the effects of medication, everything. I'm not alone. So let's get back to this. It says that sexual dysfunction has been implicated as one of the major factors contributing to non-compliance with antipsychotic medications. Now, when you're a psychiatric patient, you will soon find out that even though they say, oh, it's your choice and you can do what you want and we're here to empower you, the minute you sort of say, well, I don't want to do that, or I don't want to do that, they immediately say you're being non-compliant, you're not working with our treatment. And sometimes they'll even say, we're not treating you any longer because you're not complying. When there's an issue to do with medication. And one of the major factors with the side effects of medication, although now what they call second generation antipsychotics are a whole lot better than what was in the 60s, which would just kill you drive, like leave you like, a little bit of dribble coming down and like that, so but even so, there are issues there. And one of the reasons that people stop taking medication, even though they know they need it, they know they're unwell, they know it's working, is because of sexual dysfunction. It's one of the major things. And there's that feeling of just being dead from the waist down, and emotionally dead, and nothing bubbling up, and nothing, and then also just the weight gain that you put on, not all of us, but most of us, and just the lack of enjoyment. So some things are to do with the illness, but some things are to do with medication. This tends to focus more on the drugs. It's more from a psychiatrist's point of view, this one, rather than a psychologist. And they've said a recent survey noted that people with schizophrenia identified personal relationships as one of the treatment areas with the most unmet needs. Oh, what a surprise. No, it's not a surprise. A better focus on preventing sexual dysfunction in schizophrenia would greatly improve treatment. I would add to that a better focus on helping schizophrenic and schizoaffective patients manage their interpersonal relationships and their own inner fears regarding them would definitely improve treatment. So, they say, although it's important to examine the relationship between medication and sexual disturbances in schizophrenia patients, these patients may have an underlying hormonal disturbances that pre-exist or contribute to sexual disturbances that occur. Lack of sexual activity may result directly or indirectly from having low social confidence, few personal relationships, a loss of impulse control, and deficit symptoms such as lack of interest and anhedonia. Anhedonia is just basically you just feel nothing makes you happy anymore. You can't enjoy anything, and that is partly to do with medication, and it's also partly to do with the illness, because our illness has our positive, they're called positive, which is the psychosis, the hallucinations, the mania, if you're schizoaffective, and then there's also the negative, which is the complete withdrawal into the self, like a very, very severe depression. Basically, what they're saying here is that prolactin levels, which is, I think it's a hormone, I think it's made by the pituitary gland, and that can affect people because it can be connected to their antipsychotic medication. Especially in men, they can develop breast tissue, and it affects the rest of their hormones, and it can be quite upsetting for them. So that needs to be looked at, and there are some medications that are better than others. I think the one that I'm on, which is quetiapine, Seroquel, is the least likely to cause sexual dysfunction out of all of them, according to this anyway. And it also reports, you know, other things. So low estrogen levels. What else does it report? Yeah, basically it's also saying here again, the psychiatric literature contains some reports describing sexual disturbances in schizophrenia, but few well-designed studies. Furthermore, only a few of these reports describe sexual function or dysfunction in women, which is what I said to the psychologist who was, you know, looking into side effects. And what they've noticed here as well is that several mechanisms can cause sexual dysfunction during antipsychotic therapy. Non-specific effects such as sedation, just feeling knackered all the time, and weight gain. Yeah, hello. Can lead to diminished sexual interest. Well, that's affecting your self-esteem and the fact that you don't have energy to do anything. So this is generally, it's talking about men, priapism. That sounds really scary. It's like a sustained erection that just stays up and gets really painful, and then after that you have huge problems, and that can be caused by some side effects. Yeah, we don't want that. We're not in favour of broken penises, are we? So you know, it talks about that. And then it says most people don't report sexual dysfunction, but because of the personal nature, and men are more likely to report sexual dysfunction than women. But when the schizophrenic patients and schizoaffective patients are actually asked by the nurse or by the doctor if they feel comfortable, they're happy to talk about it. This again and again in this report, it says the same thing, that the problem is with the nurses and the doctors feeling completely uncomfortable talking about this and not feeling that they have enough information in their resources where they can just go into professional mode. You know, a bit personal really and embarrassing. And there's other things there, going back to the stigma, but that's another report. So, you know, but when people are questioned, so if you rely on spontaneous reporting of sexual dysfunction, people just telling you, the rates of sexual dysfunction will look low. But if you actually ask the patients, are you experiencing any form of sexual dysfunction, any form of problems with relationships and sex or whatever, the rates are high, really high, higher than the general population, and a lot higher. So because of the high prevalence of sexual dysfunction in schizophrenia, its relationship to non-compliance, like basically not taking your tablets, and people's willingness to discuss it, sexual functioning should be appropriately discussed and assessed in both clinical and research settings, as it should. There should be studies done on this, because this is about your happiness and your self-identity as a human being, and we are human beings. We're not just bloody illness. They tell us, don't just see yourself as an illness, but it's generally them that just see it that way and deny us access to therapy and things that, you know. So it's talking about all the different bloody antipsychotics and antidepressants and the effects, and I'll read the conclusion because this is interesting. It's striking how little attention has been paid to the area of sexual functioning in schizophrenia. Convincing evidence exists that patients with schizophrenia are open to discussing sexual issues, and more than 75% of those with severe mental illness believe that discussing sexual issues may actually be beneficial for their outcome, like generally their happiness, their wellness. Proper sexual education and counselling must be integrated into the treatment plan, and this is where I think there needs to be a specific person to do this, because not everyone can talk about these issues. Given the high rate of sexual dysfunction among patients with schizophrenia and its negative relations to compliance, taking your tablets, being a good little girl, it is, and turning up for your appointments, it is troubling that more attention has not been paid to its assessment. Although this domain is difficult to measure objectively, researchers need to work at standardising rating instruments. Don't really understand what that means. Researchers should also focus on discerning the effects of different treatments on sexual function. Although this past decade has seen some attempts to better address these issues in schizophrenia, much more attention to this topic is needed to improve treatment and outcomes for those who suffer from this devastating illness. That is it. This devastating illness. It can wreck your whole life, really. And our rates of suicide, I've said before, are very, very high. And just general unhappiness. It's very sad, very difficult illness, and yeah, and I think there's a lot of stigma as well. So, right, I don't know whether to end this now and just start again with the next report or carry on going. So I don't know how long this has been. 21 minutes, blimey. Right, let me have a sip of wine and a cigarette and I'll see how I feel. Sorry about that. Red wine today because I'm supposed to be cooking a lasagna. It's still not in the oven. Never mind. I know this is all very dry, so I'll just waffle on a bit about myself, for instance. I mean, I don't know how much I'm willing to kind of say, but the next report will kind of, I couldn't believe it when I found it, because they've actually done a report and a study from the point of view of the patients and using their narrative in it, rather than just a clinical thing that's all to do with brain chemicals and la 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 and this and this and this and this. And also, you know, most reports on this are done directed at the clinicians, directed at the nurses, and they're about how do you keep your patients safe from being sexually abused while at the same time being able to support their human rights, that if they want to fall in love or to form a relationship with another patient, how is that managed? And there's a lot of, I think, literature about, you know, how do you manage these things, and the general consensus seems to be is just don't have it going on in the hospital or the community. So people feel very, I think, very disturbed talking to someone with severe mental illness about sex. And the thing is like, you can see where they're coming from, because, you know, I've seen people when they're very, very unwell, people that I know, and they're certainly not sexy when they're completely unwell, and they don't feel sexy either. They are gone and very, very ill and need a lot of care. But that's not who they are, because once they get the care, once they get the treatment, they change, they get back to themselves, their personality starts to come through, their feelings starts to come back. Even if it's not even just sex they want love. All these things come back for them once they're getting the correct treatment. People who seem to you very ill and you think they might never ever recover, it's not necessarily the case. I know somebody recently who was very reluctant to go on depot injections. Depot injections, for those who don't know, are sort of like, just watching the time, I think I'm going to turn this off and then do the next one. Depot injections, you know, you can get injected in your backside with these really strong antipsychotics and mood stabilizers. But my God, since he has been on it, there's no hope, because he knew when he was ill that he couldn't cope with a job, with studying, with a relationship with a woman. He couldn't cope with it, and that made him completely depressed. And now he's well and getting better, and he might have ups and downs, and that's fine, because we all do. But now there's hope there. There's a sense of, okay, I don't want to overburden myself, but maybe I'm not, you know, completely mad for thinking that one day I'll be in love and be married again and be happy. And I'm really happy about that. So if people, you know, if your psychiatrist suggests medications that you don't necessarily want to take, don't completely dismiss it. Research it, think about it, think about the effects for you. I'll try to make the next one more personal, but it's like, can I just show you? It's a big, massive report, and it's really, to me, it's fascinating. I love it. Yeah, I'm gonna knock this one on the head, and go and get a glass of water and do what I need to do. I hope this has been of some use. The next one coming up soon. Okay, God bless.